everybody, welcome back to the Osteophysio YouTube channel. Today we are continuing with our new headache series and we are going to be looking at post-traumatic headaches. Post-traumatic headaches, or headaches attributed to trauma or injury to the head or neck, are considered to be one of the most common secondary headache disorders. There are different types when it comes to post-traumatic headache. So you can either have an acute headache from severe to moderate trauma, or acute headache from mild trauma into persistent headache from either severe or moderate or mild trauma. So during the first 3 months post-trauma, this is considered to be in the acute phase, and then after this it is then classified as persistent. So what do we mean when we talk about trauma? So this is looking at different injuries, for example a whiplash injury or a trauma from sport that can impact the head or the neck and can trigger headaches to form. Typically, for a headache to be classified as a post-traumatic headache, it has to happen within 7 days post-injury. Although some studies have shown that it might come on a little bit later, there's not enough evidence to support this at the moment. So although it might seem arbitrary looking at the 7 days, that is typically the classification that they would look at. So for a post-traumatic headache, it might be that the headache is the symptom in isolation, so it might be the only thing that they are reporting. What's most common is to have pain and tightness up into the neck and the shoulders, potentially dizziness, potentially feeling a little bit nauseous. So there's lots of different symptoms that can come in. What's really interesting when we look at the headache classification with a post-traumatic headache is it can mimic or look very similar to migraines or tension type headaches that we've discussed in other videos. In addition to this, there's a variety of different symptoms that can occur. One of the big things that might happen with this is people tend to take lots of medication when they've had a headache after trauma, so this might lead to a medication overuse type headache. You can also get changes in mood, irritability, but the things that we're most concerned about when someone's had a trauma is if they're in that acute phase and they're getting different symptoms like changes in gait, vertigo where the room's spinning, nausea, vomiting. So what you should be looking at post-trauma to the head and the neck if you're getting a headache is going straight to A&E and getting this assessed. Most of the time that will be the case anyway if you've had a whiplash injury, but it's worth looking in that acute phase and making sure there's no intracranial damage after that trauma or any other worrying or concerning symptoms. So what are the next steps in terms of treatment and management? So if we're looking at that acute phase, really important if you're struggling with that headache to go and get everything checked. So for example, if you're struggling with a really severe headache, they're going to look at, levels of consciousness, awareness, gait, any kind of nausea or dizziness that might indicate that intracranial pressure or damage or anything that's changed since the trauma. So what's really important in that acute phase, particularly straight after the injury or the trauma, is that you get those assessed and they know what's going on, which might also include imaging to the head and the neck to make sure there's no damage. If you're struggling with persistent headache, so this is where we're looking after that acute phase, so within 3 months and you're getting those persistent headaches still, that's when you would definitely want to go through the same procedures of imaging, particularly if you're struggling with dizziness or loss of consciousness, all of these worrying symptoms. The most important thing initially is we know if there's any additional damage and the cause of your headaches. What they predict in terms of pathogenesis, in terms of what's going on with the headache, is they put it down to either trauma or damage around the cerebellum or into the brain, and they've also put it down to possible damage or fracture or issues with the neck. Finally, if you're coming in later, so kind of the role of the manual therapist, so osteopath, chiropractor, physio, what we might look at with a post-traumatic headache, once you've had that all cleared and everything's fine, we would then want to look at the surrounding structures to see if that might still be impacting tension and tightness around this area. So this would consist of a thorough screen of the head and neck in terms of active and passive movements. We'd be testing any neurological symptoms if you're still finding that you're getting them down into the hands or into that upper body. What we would also want to check to see how it feels around that area, to see if there's any tension or guarding from that whiplash trauma, and then what we would do is provide you with a diagnosis to give you the grading of that whiplash injury from grade 1 to 4, talk through appropriate treatment that might be right for you, whether it's exercise, hands-on, even acupuncture, and then give you a very clear action plan on prognosis to help get you back on your feet after trauma.